morning. How are you doing?
Hi, I'm good. How are you?
I'm good. How's you and your baby?
We're doing good.
That's good. All right, my name is Bella. I'll be your student nurse for today.
Okay.
So, as we know, you're gonna go home, right? Are you excited for that?
Yes. So excited to go home.
Perfect. So before you go home, I want to go over something, some important information for you to take care of yourself and also the baby. So first, let's talk about bleeding. How's the bleeding? Like, is it bad for you?
It's still kind of bright red.
Okay. So let's start with the postpartum care. After birth, it's normal to have vaginal bleeding, which is called lochia, as you know. It will be bright red for a few days, and then it's gonna turn pink and brown gradually. And it should be lighter over time, not heavier. If it's heavier, do let us know so we can have some intervention for that. For peri care, you can use peri bottle for warm water every time you use the bathroom, and just pat dry it with the paper towel, a soft paper towel. Don't rub it because it can cause like incisions or make it worse. And if you soak more than one pad in 1 hour, passing clot bigger than a golf ball, that's not normal, and you need to call us, okay? And you may, for the medications, and also your breast, is it hurting?
It's a little firm, a little tender. Yes.
Okay, yeah, it should be normal like that. Just if you breastfeed them, you're not breastfeeding, or do you breastfeed?
I'm gonna probably do a bit of both.
Both? Okay, yeah. So you can, for the breast, you just wear supportive bra, and if you decided not to breastfeed them in the future, avoid stimulations. You can use cabbage to stop the milk coming out. For the medication, you may go home with some pain medication and stool softener and also blood pressure. Take everything exactly as prescribed, and if you're feeding, most medication are safe, but always check before you're taking anything new. For activities, do listen to your body. Avoid lift anything heavier than 10 pounds. Gentle walking is encouraged, and avoid strenuous activities until your provider clears you. Rest as much as you need to. For driving, you shouldn't drive while taking narcotic pain medication because it can make you feel sleepy, and it's dangerous. Most people wait 1 to 2 weeks, but follow with your your provider instructions. If you have a C-section, keep the incision clean and dry. Wash gently with soap and water, and avoid tight clothing. Watch for signs and symptoms of infection like prolonged discharge, pain, swelling. Please watch, and if you have fever over 104.4, foul-smelling discharge, painful urinations, call your provider if you notice any of these. Emotionally, it's completely normal to have mood swing and a few tears full. We call that postpartum blue. But if that lasts over 2 weeks, then it's called depressions, and we encourage you to reach out to your provider about that. Next, we're gonna talk about follow-up. So make sure you have your postpartum follow-up appointment, usually around 6 weeks or sooner if your provider instructed you. Please seek immediate medical attention if you have heavy bleeding, severe headache, vision changes, chest pain. These can be serious complications. All right, now we're talking about the babies. For feeding, breastfeed baby usually eat 2 to 3 hours, about 8 to 12 days. Formula fed baby, as you said, you're gonna have formula and half breast, right? Mm-hmm. So they're gonna eat 3 to 4 hours, starting from 1 to 2 ounces per feeding. Baby should gain weight by about in 2 weeks. For diaper output, expect 1 wet diaper for day 1, 2 for day 2, and 3 for day 3, and so on like that. The first stool will be black to greenish, and that should be okay. And if you breastfeed, the stool have yellow color. For umbilical care, avoid getting water into it while drying. It will start falling down in about 2 weeks, and notify your provider if you see any redness, swell, or odor. After the cord fall out, and you can stick with sponge bath, keep the water warm, and never leave the baby unattended. For safe sleep, and do you know anything about SID?
I don't know anything about it.
Okay, so SID is the sudden infant death syndromes. So like it happens when baby seems like fine, normal, but death suddenly. So to prevent that, we always place baby on their back to sleep on a firm mattress, no blanket or like a stuffed animal in their crib. And you can share room, but don't share bed with them because your bed, you might be like unattended to them and then maybe make the baby suffocated. So make their own space, avoid overheating. Your baby normal temperature should be around 97.7 to 99.5. If it's below or above, call your provider right away. Jaundice is normal for the first few days, but it should resolve resolve after 14 days. If it's not, definitely call your provider. Your baby is a girl, so she probably not circumcised, so we okay about that. Just watch for swelling, bleeding, infections anywhere in the baby. For car seat, always use the rear-facing car seat in the back seat. Straps should be snug, and chest clip should be armpit level. Alright. And also wash your hand before handling baby. Avoid exposure them to large crowd or sick individuals. Baby naturally squeeze and to clear their airway. If your baby seems to be congested, you can always use saline or bulb syringe. Or if they have trouble breathing, turning blue, grunting, or anything, call 911 immediately. You should see if the baby, as we talk about, if you see fever about 104, poor feeding, vomiting, go to the emergency department. Or if they have seizure, difficulty breathing, blue, we're gonna definitely go to the ER. Lastly, your baby would need follow-up appointment with 1 or 2 days after discharge to check for weight and jaundice. Make sure you're there to check for your baby's wellness. That's everything you wanted to go over with you today. That's a lot of information, but do you have any question for me?
I think I'm good.
Okay.
Thank you.
All right. I hope you have a good day.
Thank you.
Bye.